Hello, welcome to this session on forensic evidence collection and storage. My name is Suhaila Aboud and I'm a clinical management of rate specialist based in the UNFPA ASRO or Arab State Regional Office. You have taken a few other lessons that gave you a foundation on this course on clinical management of rate. You have understood on what GBV is, the types of GBV, how to examine survivors, as well as how to provide first-line care. So now we are going to look at the forensic evidence collection lesson. You need to understand that it is not mandatory to conduct forensic evidence collection and analysis. However, if the survivor consents to this examination, then you can go ahead with it as long as there is a means to analyze this forensic evidence collection. The objectives of this lesson today is to, by the end of this session, the participant should discuss the key elements of medical forensic evidence and its value. The participant should be able to describe the different types of forensic evidence, should be able to explain the process of obtaining forensic evidence and where it's applicable, should be able to undertake effective clinical documentation and testimony, as well as discuss the chain of custody for the collected evidence. Should also be able to describe the clinical and legal roles in gender-based violence evaluation and be able to recognize the different injury patterns. So first of all, we need to understand what evidence is. We have been mentioning forensic evidence before. So when we talk about evidence, it means it's the means by which disputed facts are proved to be true or untrue in any trial in the court of law or on an agency that functions like a court, for example, in a tribunal or in a case of inquest. So there are normally two types of evidence: direct evidence, what is usually perceived by the five senses, which proves or disapproves a fact or an issue. For example, someone says that I saw the perpetrator did this and that. Here, the person has used one of the five senses, which is sight, so that is direct evidence. Indirect evidence is a set of facts when considered together proves or disapproves a fact in an issue. For example, if there is a murderer that has occurred and it is said that the woman who was murdered was last seen by so and so. So indirect evidence would say that the person who was last seen with this woman could have been involved in the issue, in the murder that we are talking about. So why do we collect forensic evidence? Forensic evidence is collected during the physical examination mainly to confirm recent sexual contact, to show that force or coercion was used, to possibly identify the assailant, or to corroborate the survivor's story. So how do you confirm that a recent sexual contact has occurred? Maybe, for example, by seeing or by identifying presence of spermatozoa. You can confirm or show that force or coercion by use, for example, if someone was intoxicated or if their clothes were torn. You can possibly identify the assailant either through DNA or maybe through describing the unique characteristics or special marks that the assailant have. For example, they had a unique scar in maybe say their face or their abdomen. This can be used to identify the assailant. And lastly, to corroborate the survivor's story. So how do you corroborate the survivor's story? For example, if a survivor said that during the sexual assault that the man who wanted to assault her tried to stab the survivor and the survivor held the knife with the arm, and on examination you are able to see the cuttings of the laceration on the survivor's hand, then here you've been able to corroborate the survivor's story using that forensic evidence that you have collected. Why is clinical examination important? We should know that medical evidence is the bridge that links the health and the criminal justice system in the care and management of survivor. However, if there are no means to analyze this evidence, then it is not recommended to routinely collect forensic evidence uh, for survivors. Many of us work in humanitarian setting, and sometimes it's not possible to collect evidence. So you do not want to put a survivor through the whole process of examination and forensic evidence collection and giving them hope that something can be done, and then maybe there's no means of analyzing this evidence, and it's not recommended to do that when you are in that position. So there are different types of evidence. We have the physical evidence, and this refers to any object, material, or substance found in connection with an investigation that helps establish the identity of the offender, the circumstances of the crime, or any other fact deemed to be important to the process. So this could be physical evidence like a piece of condom, cigarette butts, ropes, masking tape, whatever that can be found in the environment, or also known as the crime scene location. So we have introduced the word crime scene. So what is a crime scene? Most of us think crime scene as a location, but a crime scene can either be a person, a place, or an object that is capable of yielding physical evidence which has potential of assisting in apprehending or exonerating the suspect. So anything that is capable of yielding evidence is known as a crime scene. You see, a person is a crime scene because we collect evidence from a person. For example, we can take a high vaginal swab, we can take a swab on a skin, you can document the injuries of this person. So a person is also referred to as a crime scene, or it's part of a crime scene. Then we have what we call the forensic analysis. Forensic evidence collected by medical professionals is given to the police, who transfer the evidence over to the forensic lab or the crime lab. Sometimes it's also known as government chemists, to test and analyze the evidence. Each country has different processes on how this is done. So evidence is not collected for the police, but the police transfer the evidence from the health worker to the government chemist, and then they analyze the evidence and give it to the court of law. So there is what we call a chain of custody, and this needs to be maintained for the evidence to be valid. We have a famous scientist who's called Lockett's, and he has what is called the Lockett's exchange of principle, which states that every contact leaves a trace. This Lockett's exchange principle tells us that a perpetrator always leaves some form of evidence whenever they come into contact with the survivor. So it is up to us to be aware of this different evidence that they may leave, so that we can collect it if the survivor consents. He states that wherever he steps, meaning the perpetrator, whatever he touches, whatever he leaves, even unconsciously, will serve as a silent witness against him. Not only his fingerprints or his footsteps, but his hair, the fiber from his clothing, the glass he breaks and tool mark he leaves, the paint he scratches, the blood or semen he deposits or collects. So there are many types of evidence that will be collected from this. So the types of evidence that can be collected include the medical report. Medical report normally has the history of what happened or the circumstances surrounding the evidence, and it also has documentation on the injuries that were observed during examination that the clinician documented. Then we have clots, we have foreign materials, foreign hairs, presence of spermatozoa, blood or urine to test for toxicology or DNA analysis. All these are types of evidence that can be potentially collected. Note that consent must be acquired before proceeding with every step of forensic evidence. So the forensic examination process will include history taking, where the following evidence is collected. So there is the general evidence, the body evidence, and the anogenital evidence. So with the general evidence, first we are going to look at the general forensic considerations before collecting evidence. You must ensure we wear gloves throughout the evidence collection process and change them frequently when examining different body types, because this prevents possible contamination of specimen and exposure to body fluids. Also collect evidence as soon as possible. The likelihood of obtaining viable specimen decreases over time. For example, if somebody comes after 1 month or after 3 weeks, you are not able to collect any type of evidence from them apart from just the history taking and maybe examination of the injuries that might be there or may not be there. So as soon as the person presents, you then have a higher chance of collecting different kind of evidence. When collecting specimens for medical testing and forensic samples, ensure you collect the forensic samples first. For example, if you want to take urine for toxicology and you also want to do a urine test for pregnancy, ensure you're collecting the sample for toxicology first before using it for other lab tests, so that you get the most viable biological materials in the first specimens that are collected. Handle specimens appropriately. Ensure that specimens are packaged, the ones that the evidence which is wet is dried and transported properly. Clothing evidence should be bagged individually in paper bags. And when we talk about paper bags, we mean the khaki bags and not the plastic bags. Label specimens accurately, preferably with a code of the patient and not the name of the patient. But in some instances where the coding system is not used, names are used, but all these documents should be kept in confidential, lockable cabinets. The date of birth, the source of the specimen, the date and time collected, and the health worker should provide their name or initials according to the policies that you have as the person who has collected this evidence. Ensure the security of the specimen, that they are collected and put in lockable cabinets, and they are not tampered with, because this is specimens that will be used in the court of law. Minimize the number of people handling the specimens, and ensure you have a chain of custody that can be traced, that a specimen moved from person A to person B until it reaches the court of law. So general evidence always includes things that are not that are found in the environment and not on the body or the genitals of the survivor. For example, debris, sanitary pads, clothing, all these should be packaged differently. So how do you collect this general evidence? You have to ask the survivor to stand on a clear sheet of paper, which we also call drop sheet, and collect all the debris that will fall down while they are undressing or while they are removing the clothes that they want to give out as evidence. You might ask yourself, why do we need to collect the debris? The debris can help us to corroborate the survivor's story. For example, the survivor mentions that she was sexually violated in a bushy area or in a sandy beach. When you collect the debris, you notice like pieces of grass or pieces of leaves or the sand. Then you are able to corroborate the survivor's story with what you have collected as evidence. These are samples of evidence bags that can be used to collect evidence. You can see that they have a chain of custody where you label what kind of evidence has been collected, who has collected it, what time it was collected, and to whom it has been handed to. One thing that you should think about is, why don't we use plastic bags when collecting evidence? I hope you note this down so that we can talk about it when we meet in person. Why we don't use plastic bags when collecting evidence. So now there are a couple of videos that will be shown, and these videos will talk about collection of evidence before examination and collection of evidence during examination. The sounding system of the evidence of the videos might not be good, so I might try to speak into the video and guide what is going on. So a health worker is asking about any pieces of clothing that might be collected from the survivors. So you need to ask consent from the survivor before collecting any type of property that they may have, because there may be some sentimental value to some of the pieces of clothes that you may be requesting as evidence. Don't ask the survivor to totally undress. While you are collecting her clothes, ensure you are covering the survivor with a blanket or a piece of cloth to maintain their dignity throughout this process. Ensure that the collected material is put in the paper bag and it's labeled before you offer it to the chemist that analyzes it. You can also collect evidence during examination. That was before examination. Now we are going to look at how to collect evidence during examination. So remember that you will be doing examination at the same time collecting evidence collection. These two things are done concurrently so that you don't have to expose the survivor twice, like let's do examination only, or now let's do forensic evidence collection only. So for example, saliva where the perpetrator kissed or licked can be potential areas to collect some evidence. Ensure they are air dried before they are packed. Putting swabs like this can risk them into for decontamination. Here we are collecting evidence from the finger bed. You can use a small swab or a toothpick or cut the nails very closely. Then fold the paper and use that for forensic analysis. You can collect trace materials from injuries before washing the injuries, and ensure you are documenting very well in the body diagrams of your history and examination forms or forensic evidence collection forms. Always explain to the survivor what you are doing, and ask them whether it's okay to proceed with whatever you want to do. So knees bent and legs relaxed to the side. Ensure the envelope is well sealed and labeled. So you can see for the body evidence, you can collect oral swabs, skin swabs, foreign material on the body, any semen-like stains on the body, swabs from suspected alleged bite marks or areas that were licked or kissed by the perpetrator, as well as the fingernail scraping as we saw on the video before. So here is a picture of one doing an oral swab, and that was for the body evidence. For anogenital evidence, this include evidence like pubic hair, vulva swabs, or pubic hair or vulva and swabs of the same, including matted pubic hair, combing of pubic hair, labia majora swabs, labia minora swab, vaginal swabs, vaginal smears, perianal and rectal swabs and smears. And you can also use photographs and documentation of the body injuries. So with photographs, you have to check with the evidence collection laws in your country to see what is allowed in that country. Because in some countries, they may allow photographs, but maybe, for example, say they only allow photographs that were taken using an analog camera and not a digital camera, or they might only allow certain people to take photos, or certain supervisors in the facility to take the pictures. So you have to ensure that you are updated with what the law says. You can see here is a swab that can be used to collect high vaginal swab or oral swabs, skin swabs, or penile swabs. Ensure you are using these modern swabs that can be capped and can be named so that you avoid contamination. In our video, we saw that they were using the old swabs, and the swabs were kept very close to each other while open, and that allows room for contamination. We've already seen how fingers, nail scraping or clippings can be collected in the video. So the evidence of the perpetrator's skin cells can be found under the survivor's fingernails. Scrapings from the fingernails can be collected and put in a well-labeled envelope, and these fingernails may also be trimmed and also kept in an envelope as a source of specimen. So the next question is, you have learned about how to collect this evidence, but do you have the sexual evidence collection kit? Are they available? Do you procure for the sexual evidence collection kit, or you locally assemble in your facility? So in our online meeting, we are going to talk about the sexual evidence collection kit and see how you handle this in your different facilities, whether you have all the equipment that is needed to assemble an evidence collection kit. So now we are going to play a video on evidence from collecting evidence from external genitalia, and then collection of evidence from vagina and rectum. Again, we may not be able to hear what the video says, but I will guide you into it. So moisten the high vaginal swab with sterile water, and not, for example, use um, lubricant. So it's preferable to use a speculum for women survivors if they agree to have you use a speculum. If they do not agree, it's still okay. So when using a speculum, wet the speculum with sterile water and not using a lubricant, because when you use a lubricant, it can um, interfere with the material you're collecting. Ensure you are air drying the swabs at room temperature. It's dried, cap it, then send it for microbiology. You can collect the sample from posterior fornix or from the cervical os. So posterior fornix, you can collect up to 5 days. In the cervical os, you can collect up to 12 days of after sexual violence. You can also collect samples from the patient's rectum if it's indicated in the history of the survivor. Document all evidence collected after completion of the forensic evidence collection in the required forms. You have to understand that penetrative sexual activity of the vagina, anus, or mouth rarely produces any objective signs of injury. So it is possible that a survivor of sexual assault presents without any signs of injury, and this does not mean that they have not been sexually violated. Also, the hymen may not appear injured even after penetration has occurred. Hence, the absence of injury does not include penetration. The health practitioner can therefore not make any comment on whether the activity or the sexual assault, the sexual activity was consensual or otherwise. If you have not understood this or you have any comments on this particular slide, please note it down so that when we meet in our online session, we are able to discuss this topic. So for forensic specimens, we mentioned that the specimens are viable only within a certain time. So like for example, blood for toxicology, you can collect specimens up to 48 hours. For collection of specimens on the skins, for example, swabs on the skins that targeting bite marks, you can collect up to 72 hours. Collection of samples from the mouth, for example, there was an oral penetration, you can collect a sample up to 12 hours. For the vagina, if you are collecting from the posterior fornix, you can collect up to 5 days. And if you can collect from the cervical os, then you can collect up to 12 days. In the anus, you are only able to collect up to 48 hours. If it's foreign materials, for example, a piece of clothing or a condom or ropes that were used to tie the survivor, then those do not have a time limit because they are not biodegradable. For things like urine for toxicology, you can collect up to 5 days. Always remember that any wet samples need to be air dried at room temperature and not directly under the sun before they are packed. Document transfer of specimen using the correct chain of custody. What have you collected, to whom have you given, and when was the transfer occurred. Ensure specimens are stored appropriately. Stop when the survivor is not willing to go on with the process. We say that this process of forensic evidence collection you need to have consent from the survivor. So if the survivor gave you consent and you began and at some point they got tired or they felt pain or they felt uncomfortable to go on and they request you to stop, then you are supposed to stop immediately as per the survivor's wish. So this was some of the forensic evidence that we wanted to talk about. And also we say that part of forensic evidence is documentation of what you have observed from the survivor. So for you to be able to do a proper documentation, we need to understand the different types of injuries that can occur from survivors. So you need to understand the different types of injury and use the correct terminology for this injury. For example, there are different injuries that are caused by different trauma. So blunt force trauma causes injuries like laceration or tissue breach, contusion, hematomas, petechiae or bite marks, or can cause abrasion or glazes or bruises or trimline injuries, scratches, ligature marks, fingerprints, or fracture. All these caused by blunt force trauma. And then we have sharp force traumas that cause different kind of injuries. Sharp force traumas can cause like incisional injuries, for example, a cut which has been caused by a knife, which can be superficial or deep, penetrating in incised wounds, for example, caused by a stab, or chop wounds caused by heavy instrument with one cutting edge. So this type of injury really points us to uh, what object was used to cause that trauma. And this helps in corroborating the story of the survivor. So we need to be very careful and very keen to use the proper terminology when describing the injuries. We also have thermal injuries, and this could be caused by hot objects, hot liquids, or radiator, or corrosive injuries that could be caused by chemicals. So in this picture, what kind of injury can you see? Actually, this is a blunt force injury that this is in the mouth on the epiglottis, probably that has been caused by oral sexual assault. You can see that there is reddening and petechiae ecchymosis of the epiglottis as shown on the picture. We can also say that different skin wound patterns give us or make us reflect on what type of injury or what type of weapon was used to cause this injury. For example, in the first pattern that we see, that was caused by a knife. You cannot compare it in the second last or the last in the second last pattern, which is a pattern that was caused by a fork. So again, it's very, very important to describe well how the injuries appear. Also, the injuries give us a clue on the depth of the object that was used. So a different skin wound pattern will be suggestive whether it was deep penetration or mid-level penetration or superficial penetration. You can see this is an example of a bite wound with amputation or loss of upper lip. So for such kind of an injury, obviously you cannot describe this as an incisional injury because it is not. Then you can see sharp force injuries like a bite wound causes a different type of pattern compared to something else or a blunt force injury. So ensure you are describing the pattern of the injury well and giving specific length, width, or the color of the injury at the time of examination. You can also see that this is another bite mark, and you can describe it. The different color changes on the skin also give us a clue how many days this injury has stayed. You can see another injury. This is an imprint contusion, and this injury has been caused by a slap. You can almost see the fingerprints on the cheek of this survivor close to the ear. Then this is an incisional wound. Obviously, this could have been caused by a sharp object like a knife. And also when describing such an injury, describe the edges of the injury, the length of the injury, how deep it was, using the correct and specific measurement. You can either use an ABA4 ruler as has been shown on the picture, or you can estimate with your eyes or use a normal ruler if that's what you prefer. We can see another injury, and this injury has been caused by an iron box, an iron, and if you describe the injury as using the shape and the color, then you are able to corroborate with the story of the survivor that has presented with such kind of an injury. So handling, collection, and preservation of evidence. The following practices must be followed when handling any specimen. Protect the exhibit from weather and contamination. Ensure you're keeping them in a room with minimal or no human or animal traffic. Use sterile instruments and containers. Wear powder-free gloves. Clean gloves are okay, but if you have sterilized gloves, even better. And wear protective gear where appropriate. For example, if you're collecting evidence, you want to ensure you have covered maybe your eyes, or you are wearing your goggles, you are wearing something to cover your head. So, for example, you don't have hair dropping in the specimens that you are collecting. Uh, Change gloves when handling or collecting different specimens. Package, transport, and store exhibits safely and securely. Take special precautions with fragile and perishable specimens. For example, if you have collected urine for toxicology, maybe today, and your lab is closed, what do? You cannot keep it like, for example, a blood specimen. You have to ensure that that urine specimen is refrigerated, so that if your lab opens tomorrow, then the specimen is still viable. Call on an expert if you lack adequate training to handling a particular specimen, or if you are not sure what to do. So now we are going to look at a video on preparation, storage, and dissemination of evidence. So all evidence collected need to be sealed, uh, transported properly, and ensure that it's not tampered with. Ensure you are using the correct chain of custody when transporting this evidence. What we have seen in this video, where all swabs are put in one envelope, is not a good practice, because there is possibility of contamination. So make sure you are using swabs which you can cap and are individually labeled. So thank you very much for being with me on this lesson on forensic evidence collection. I hope you have learned useful tips on how to conduct your forensic evidence collection and how to store your samples. And if there is any question that you would want us to discuss more in our online webinar, make sure that you are noting down those questions now, so that you don't forget them. And when we meet as a class, we can share our experiences, we can have an opportunity to ask these questions and hear answers from the different practices that we are doing, and get guidance from me. Thank you very much for watching, and see you later.